Hi students, this is Dr. Badrinath and today's video is a tetracycline antibiotics. See, tetracycline should not take along with the milk. Very, very important bit, and number of times it was appeared in all GPAT examination, all competitive examination. Tetracycline should not take along with the milk. Very, very, very important. So here this doctor has told to the patient, hey, you patient, I am writing the tetracycline, don't take with the milk. Like that, the doctor has given a warning. See, our Indian patients are very intelligent. What they will do, instead of milk, they will take tetracycline with coffee. They will take tetracycline with the tea. See what happens. See, this coffee and tea also consist of a milk. Okay, so there was a biggest problem. What happens here, I will tell you. If you are taking a tetracycline along with the milk, it forms a big complex. See here, tetracycline calcium complex. Calcium is present in the milk, we know everybody. So tetracycline along with the calcium, it forms a big complex. This complex size is very big so that it cannot absorb into the bloodstream from the GIT. Isn't it? From the gastrointestinal tract, over the gastrointestinal tract, it will not be absorbed. So it's because of the formation of tetracycline along with the calcium complex. This calcium is present in the milk. Okay, now what happened? It will not be absorbed from the stomach and it will be excreted into the fecal matter. Next day morning, the tetracycline will be there in the fecal matter. So waste. Your therapy, tetracycline usage is utter bluff here. Even though you are taking a plenty of tetracycline tablet morning along with the meter, it will be waste. So total treatment will become a waste. Okay, that is the main intention of this one. So what our intelligent patients will take along with the coffee, along with the tea, they will take along with the calcium supplements. You see, calcium supplements, multivitamin tablets, so multi-mineral tablets, so it consists of a calcium. Don't take with calcium. That is a very, very important. So whenever you are taking a tetracycline, take tetracycline with a plain glass of water. So before 1 hour and after 1 hour also, you don't take any food. Even calcium rich food also you should not be saying, like a curd, milk, okay, whatever it may be. And furthermore, there was one of the important point also, one more important point for GPAT and examination, DCP, dicalcium phosphate. See, this is one of the excipient very widely we are using to increase the volume of the tablet. See, some of the drugs are very potent in nature, very less dose. In such a cases, what happens? We cannot prepare a tablet because dose is very, very less. So you cannot take as such like a Horlicks and all. We cannot take. What we have to do, you have to add a DCP. Generally, we are adding a DCP filler. It is called as a filler. Oh, okay, it increases the volume of the tablet so that easily you can be punched. Otherwise, punching of tablet is very difficult because dose is very less. So this DCP also should not be used as a filler whenever you are preparing a tetracycline tablets or tetracycline capsules. So very, very important. What is the purpose of DCP? Is a filler, dicalcium phosphate. Okay, right. So this is my mobile app. You can download it from the Google Play Store. After downloading, open the app and go to the store option. See here, store option, which is present at the bottom, so that all presentations of whatever I am presenting the notes, okay, it is available in the form of course M.Pharmacy, B.Pharmacy, Pharma.D, like that it is available. You can be PD in the PDF format, it is available. You can be viewed 24 hours. And this is about my YouTube channel. In my YouTube channel, go to the playlist option. See here, playlist. In the playlist option, I have arranged all videos subject wise arranged. If you click on each subject, you will get a topic wise again. So subject wise, topic wise. See, this is your syllabus. Here you can see tetracycline, introduction, mechanism of action. These are the contents what I have covered in the antimicrobial spectrum, pharmacokinetics, etc. and all. See, tetracycline introduction. See, what is this tetracycline? Tetra means four cycles will be there. 1, 2, 3. See here, this is the structure of a tetracycline. So whenever you are writing ABCD, you will practice ABCD. No, here you reverse it. ABCD, like that you have to reverse, because this ring is called as a. This ring is called as a B. this ring is a C, this ring is a D. So A, B, C, D, you have to see whenever I will explain these points, I will explain in the medicinal chemistry. Okay, so 4 rings will be there, 4 cycles will be there. It is a 4 rings are nothing but a RD symbol. RD car symbol is 4 rings. 1, 2, 3, 4. Here you can see this is a RD car. So tetracycline is nothing but RD car. RD car is nothing but a tetracycline. Okay, and these tetracyclines are it is an antibiotic. It is obtained from the soil actinomycetes. This is a picture of actinomycetes. It is not kurkure. So when you keep side by side this kurkure and actinomycetes are microorganisms, okay, you will get confusion. Which is kurkure, which is actinomycetes? You will get confusion. Lot of confusion to you. Okay, sure, because it exactly looks like a kurkure. Okay, so antibiotics obtained from the soil actinomycetes, very important bit. And key code here, what I am giving the code is a BS. BS means it is a broad spectrum antibiotic and it is a bacteriostatic. So there are 2 things are the bacteriostatic, bactericidal. This is a bacteriostatic, bacterio and a broad spectrum. Okay, tetra means 4. It consists of 4 cyclic rings and the family is a tetracycline, doxycycline, minocycline, oxytetracycline, demeclocycline. Among all, first 2 are important, tetracycline and doxycycline. Doxycycline sales is increased like anything during the corona time. It is a broad spectrum antibiotic. Okay, it gives a support to the antiviral therapy also. Okay, see, if you see the mechanism of action. So here what I have shown is a ribosome. This ribosome is present in the bacteria ribosome. This ribosome is very essential for the bacteria for the synthesis of proteins. Okay, see here, these single amino acids will come. Okay, it will enter into the ribosome. These amino acids will form into a long chain, into a polypeptide, are called as a proteins. These proteins are very essential for the survival of the bacteria. See, this is a very important key point. Bacteria consists of ribosomes. This ribosomes synthesis of a protein, which is essential for its own survival. Now what happened? Our tetracycline, what it do? This tetracycline binds. It go and binds here. It interferes. See here, go on, binds to the site A of the 30s ribosome. Here, this is a site A of this 30s ribosome, small unit. 50s ribosome, big unit. See the number. 50 is a big. 30 is a small number. 2 ribosome subunits are there. So 30th ribosomal subunit, it prevents the binding of tRNA amino acid to here. So what happened? So there is no formation of the peptide chain. So it prevents the protein synthesis. So what happened automatically? Without a protein synthesis, bacteria will not be survived. All tetracycline families, same mechanism of action, need not to be worried. Same thing you have to write in the examination. You have to explain same thing. You have to present in the examination. And antibacterial spectrum. It is a broad spectrum. It acts against the cocci, gram-positive bacilli, gram-negative bacilli, spirochetes, rickets, protozoa. Here gram-positive and gram-negative cocci. Here you can see the various cocci, staphylococcus, streptococcus, all coccus will be there. Gram-positive bacilli, like a Clostridia. Here I have shown the Clostridia, anaerobics. Okay, and all these you can be practice it. Spirochetes, T. palladium, and H. pylori. H. pylori, H. See here, H. pylori. H. acidity. It leads to acidity. H. pylori, H. influenza. Like that, all these things you have to be practice. Even amoeba also. Entamoeba histolytica. Very important. That is also. And if you see the tetracycline, oxytetracycline properties, we will compare all tetracycline. We will compare here. Doxycycline, minocycline. Demeclocycline. Source, number of times it was appeared in the examination. Okay, oxytetracycline, tetracycline. It is a semi-synthetic, it is a rheumatocytic, okay, erifacious. All this is a semi-synthetic, this is also semi-synthetic. Minocycline, potency is a low potency, intermediate potency. Doxycycline is high potency. Number of times this is very important. For corona therapy also they use it. Intestinal absorption is a very good here. Okay, and it will not be interfered by the food. That is important. And next is all the star marks are important. Elimination, rapidly eliminated by the kidneys only. Slow renal excretion. Okay, doxycycline primarily excreted is a fecal matter as a conjugate. Minocycline primarily metabolized and excreted in the urine and bile. All this elimination is also important. And dosage 250 to 500 mg. Here this is 300 mg. Here it is a 200 mg initially. Okay, right. And when you see the phototoxicity, this is one I will explain what is phototoxicity. If you are consuming this tetracycline, you may get sunburns. Sunburns. Phototoxic. Photo means light. Photo means light. So what happens when if you are take tetracycline tablet and go and stand under the sun? So what happens? Your burns, sunburns will come. Okay, right. That's why this is toxic to the skin. The high toxicity, doxycycline, very, very important. And specific toxicity, oxytetracycline, less tooth discoloration because tooth consists of a calcium. Tetracycline will go and binds with the calcium to the teeth. Okay, calcium is present in the bones also. It go and binds with the bones also. Discoloration of the teeth, black color, brown color will come. Okay, right. It is a okay, right. Next is a preparations of tetracyclines. Tetracycline, oxytetracyclines are available in the form of oral capsules, injection vials, ointments, skin, eye and ear. And Demeclocycline, oral tablets and capsules. And Doxycycline, Minocycline, it's available in the form of oral capsules. Okay. And here injections also. And Tetracycline, organ toxicity. See, tetracycline, if you are taking regularly, it leads to toxicity of various organs. First one is a liver. See, you can see liver is having a very nicely designed. Kidney is nicely designed. Like that, you will think. Here, this is not designed. This is a fatty liver. Very dangerous. This is a fatty liver. This is a kidney. Okay, kidney cyst will be formed on the kidney. Kidney will become a failure. Okay, it is a dose-related toxicity. Higher the dose, greater the toxicity. Liver damage, fatty liver, rarely jaundice. Kidney damage is a renal failure, and it leads to outdated tetracycline. Outdated tetracyclines are leads to if convert into tetracyclines will be converted into epitetracycline, anhydrotetracycline, epi-anhydrotetracycline. Okay, it leads to Fanconi syndrome. Very important bit. This Fanconi syndrome. Teeth and bone, discoloration of a teeth. Okay, high chances of the infection of the teeth. Tetracycline chelates with the calcium which is present in the growing teeth and bone, and anti-anabolic effects. Okay, intracranial pressure, diabetes, vestibular toxicity 1, 2, 3. If you are consuming tetracycline, mic testing 1, 2, 3, no sound. It will be in a mute. And tetracycline clinical uses are empirical therapy, initial stages of mixed infection. When there was an infection of mixed bacteria, virus, fungus, they will attack each other and it starts attacking of the person. In such a case, this mixed person, tetracycline, because it is a broad spectrum antibiotic. Keep in your mind, mixed infection. So first choice for venereal diseases. Okay, and here I have done typhus fever. See, typhus fever, Q fever, rickettsial infection, relapsing fever, brucellosis, cholera. Okay, here what I have shown is acne vulgaris. This is acne vulgaris. Okay, due to a urinary tract and other situations. So first choice for all these atypical pneumonia, granuloma, lymphogranuloma, verinum, etc. So I will end my session here. All pharmacy subjects will be keep on uploading.